Hello and welcome to a special online edition of CBC News. We're bringing you the latest on how COVID-19 is affecting Nova Scotia. Here are the latest COVID-19 numbers for the province. There are now 41 confirmed cases, up from 28 at last report. The individuals range in age from a child under 10 years old to people in their mid-70s. More than 2,308 tests have come back negative. Shayna Luck is standing by with the latest. So Shayna, what happened today?
Well, Amy, we know that, as you said, there was a big spike in cases that got diagnosed late yesterday, 13 people, and some of those were family groups who came back from international travel. One person is in hospital. They were admitted over the weekend, but everyone else is at home recovering. The Premier and Dr. Strang continued to tell Nova Scotians that every single person who enters this province must self-isolate, and that means going straight home from the border or the airport. Do not stop at grocery stores. Do not take a taxi or the bus. Rely on family or friends to drop off supplies for you. The idea is to keep the number of people you might expose to a minimum. Dr. Robert Strang said so far there has been no indication of community spread, and health officials are actively looking for it. Now, a few examples of what that means. Up until now, when someone is diagnosed with COVID-19, they've waited until that person's close contacts became unwell before testing them. That's changing. They're going to test close contacts right away, and the hope is that will tell public health whether there has been spread to people who aren't yet showing symptoms.
All right, well, Shayna, what does it mean when they say close contacts?
Well, there are two elements in that. One is physical distance and one is time. So people you've been less than 6 feet away from for an extended period of time. So generally, the closer you get, the longer you stay, the more at risk you would be. For example, if you have a family member in your home and you lived with them or cared for them while they were coughing or sneezing, you would definitely be considered a close contact. And Amy, they're doing some other things as well to look for community spread. For several days now, they've been tracking people who go to hospital emergency rooms with flu-like symptoms such as fever and cough. They're not seeing any increase in those numbers, but they're watching for a spike. And if they did see that, they would swoop in and start testing people for COVID-19. They're watching as well for outbreaks of respiratory diseases in long-term care homes. And they're exploring whether they can start testing people who have fever and cough, even if they haven't traveled. Dr. Strang said he expects this week the QE2 testing lab will be able to double the numbers of tests they're working on. Right now, it's 200 a day. They expect that to jump up to 400. And the Premier and Dr. Strang also put out an appeal for people to give blood. There's an ongoing need for blood, and the collection clinics have been rearranged so that everyone should be able to maintain that physical distance of 6 feet from others. They say it is safe to give, and if you can, then you should do so. Amy?
All right, Shayna, thank you so much for the update. That's the CBC's Shayna Luck reporting. Provincial officials are at the border outside Amherst enforcing the province's state of emergency. Premier Stephen McNeil declared the emergency yesterday to slow the spread of COVID-19. They're stopping vehicles from out of province. Anyone who is not providing an essential service must self-isolate for 14 days. We'll have more on that in a moment, but first, here's what else you need to know about the state of emergency. Social gatherings are limited to a maximum of 5 people. Essential businesses like gas stations, grocery stores, and pharmacies are exempt, but people must keep a distance of 2 meters. Also exempt from the gathering limits are construction sites, healthcare services, and criminal justice. Police have the power to enforce self-isolation and social distancing, and offenders can be ticketed. Also, all provincial parks are closed. Visitors will be considered trespassers and their vehicles can be towed. Provincial trails will remain open for people to get fresh air and exercise, but gathering limits and social distancing must be followed. Municipalities across the province are also closing their outdoor and sports facilities. As we mentioned, it is an unfamiliar scene at the Nova Scotia-New Brunswick border. Checkpoints to prevent the spread of COVID-19. The CBC's Brett Ruskin has this report from near Amherst.
Well, here's a look at what began this morning. You can see provincial officers speaking with every vehicle that arrives here in Nova Scotia. They are speaking with them just a couple of moments for each vehicle, giving them an information package, and then they are allowed through into the province. But everyone who comes here, whether it be here via land, via air at the airport, or via sea, all newcomers to Nova Scotia must self-isolate for 14 days. That was the announcement made by Premier Stephen McNeil yesterday. There's some exemptions to that rule. For example, truck drivers are allowed to continue on to make their deliveries, to keep trade going interprovincially. Also, medical officials, medical staff, essential personnel basically are allowed to come and go without having to self-isolate, cases like that. But for the most part, if you're coming here to just travel or to visit, Premier Stephen McNeil saying essentially, if you do want to come here, you need to self-isolate, but otherwise don't come. And in fact, some people have been doing that. They have arrived here. Again, all traffic has been stopped and diverted here, but arrived here and then chosen, once they get the pamphlet and get the information, they actually just turn around and head back to New Brunswick, not wanting to have to self-isolate here in Nova Scotia. Again, just the latest measures taken here in Nova Scotia to try to stop the spread, contain the spread of COVID-19. Brett Ruskin, CBC News at the Nova Scotia-New Brunswick border.
And Premier McNeil says he had little choice but to close parks, beaches, and playgrounds during this pandemic. He says people were not respecting social distancing rules. And while many say they understand the measures, they found the new order vague. Colleen Jones has that story.
Point Pleasant Park, off limits. Anyone trying to walk their dog, turned away today. The Halifax Boardwalk has fenced off their children's playground and the Wave, but it's open for walkers and bikers. All provincial parks are shut down except provincial trails are open, and that's caused the confusion.
This line, is that the $1,000 fine?
That's a really good question. I don't know. Do you know?
I don't know. I think it's a confusing point.
Well, my understanding was if you could walk to it, you'd be okay, but you can't drive to it.
They aren't the only ones confused. A check of all Nova Scotia municipalities shows some trails are closed, some are open.
So the province really needs to close a few loopholes here and get some clarity around where we can go and where we can't.
That's Halifax Councillor Sean Cleary, and he's been flooded by phone calls and emails from people about the trail system that many see as a peaceful, wide sidewalk that connects communities.
They're keeping the provincial trails open, and in fact the Premier said people need to get out and get some exercise. The unfortunate part is in our parks bylaw, P600, all of our trails, gardens, playgrounds, etc. are defined as a park. So I don't think it was the Premier's intention to close down our trails, but by saying parks are closed, all of our trails are closed now as well. So one of the things I'm looking at, and actually we just had a conference call with my municipal colleagues and our senior staff, getting some clarification from the province around what their intention was and what can remain open.
So confusion from people out using the trails they weren't supposed to be on.
Very vague right now. It's very unclear, so you don't know whether that's going to be a $1,000 walk.
Premier McNeil clarified things today.
What we need you to do is walk for exercise, not to socialize.
Which makes things clearer in these very unclear times. The last word goes to the nurses on a Halifax anesthesia team who posted this to social media. We stay here for you. Please stay home for us. Colleen Jones, CBC News, Halifax.
Eskasoni First Nation has declared a state of emergency, and it took effect as of yesterday. The motion was passed unanimously by the Band Council. There is a mandatory stay-at-home order in the community, but residents will be allowed to travel for essential services, including food, gas, or medical needs. Band members who work outside of the community have to call the Eskasoni hotline for more information. Chief Leroy Denny said Eskasoni is a vulnerable community.
Indigenous people across this country are high risk, and highest risk across the country. So we're a population of 4,500, and this is an opportunity for us to act now.
A 6 p.m. to 6 a.m. curfew is in place on Eskasoni until further notice. Social distancing is in effect. Gatherings of more than 5 people are banned. Also, Armour Group Limited has put a temporary pause on trade workers at the Queen's Mark project on the Halifax waterfront. The company CEO says they've asked all of the trades working on the project to supply them with written plans outlining how they can comply with the 2-meter distancing guidelines. The state of emergency listed construction sites as one of the industries that is exempt from the 5-person gathering limit. It is a confusing day for some parents and students who may be wondering if and how they should be keeping up with their studies now that March break is over. The COVID-19 outbreak has pushed the return date for all public schools to April 6th. Preston Mulligan has this update.
For parents wondering what now, consider this from the president of the Teachers Union.
Well, for now, we don't have a plan in place. EECD has not shared the approach that will be used.
There have been meetings, 3 in fact, including one today, with staff from the Department of Education, Teachers Union, and the Regional Centers for Education. But the word is wait.
It means that we don't have a framework for what support is going to look like. Really, today is about logistics, recognizing that we're coming back off a week of vacation. Teachers didn't know that they would be working from home when they left.
The Halifax Regional Centre for Education declined our request today for an interview, but sent an email stating schools across Nova Scotia are providing limited access this week by appointment only to teachers, other school-based staff, and grade 12 students. At this time, we are focused on supporting grade 12 students to get what they need in order to meet graduation requirements. Siobhan Kennedy Cameron's daughter is in the grade 12 IB program at Citadel High. She got an email this morning from the leader of the IB program.
Just letting us know that they were changing everything and that the exams had been cancelled and that everything was going to be based on the coursework. So I think it's a little anticlimactic. It feels like she's graduated, but none of us were ready for it.
But for her 12-year-old daughter in middle school, the reality of these times is sinking in.
She suddenly realised the enormity of it and the length of time that this might be, and that March break was over and there was no school today and there's no soccer and, no socialising with friends, and so that's all gone. And it was, I think March break was one thing and now it's moving into difficult terrain.
The Halifax Centre for Education says it'll have more information to share later. Expect an email from your principal any day. Preston Mulligan, CBC News, Halifax.
Students at Dalhousie University are stepping up to help frontline healthcare workers working through the COVID-19 pandemic. They've put a team of volunteers in place offering free childcare for those medical professionals. And second-year medical student Freddie Lee is one of the organizers. Hi, Freddie. Can you talk a bit about how many healthcare professionals have taken you up on this so far? I understand you've been up and running for about a week now.
Hi, Amy. Yeah, so we opened our sign-up sheet last Monday, so 1 week from today, and we've already had a really good response from healthcare providers. We've had just over 60 sign up.
And what about the other end, the volunteers? How many have you been able to gather? Are they all medical students?
So for the volunteers, it's just over 60 as well. So we've had really good uptake from both ends. It's actually, we've opened the volunteer sign-up sheet to all students in allied healthcare programs. So we have medical students, nursing students, social work students, dentistry. We've had really good uptake from all too.
Now, were you surprised so many people are offering to help?
I was pleasantly surprised. I wasn't sure how the COVID-19 outbreak would affect the availability of our volunteers. But I was really happy to see that so many students had stepped up to volunteer.
Now, besides babysitting, are there other services you folks are offering?
So initially our focus had been on childcare because this was the area that was identified to be in the most need. But we've had volunteers sign up for other services like grocery runs, any errands, pet care, check-ins with the elderly or other members of the community.
Now, of course, everyone is being urged to stay safe during all of this. What steps is your group taking to keep the virus from spreading?
So the safety of our student volunteers and the families of the healthcare providers our top priority, and we've developed policies to hopefully address these concerns. So essentially, any students who have risk of exposure or contamination will not be volunteering, and we're currently matching one student per family, requiring childcare to limit social interaction. And we're in accordance with the guidelines from the Public Health Agency of Canada, as well as any provincial advisories.
So for folks who need your help, or those who want to volunteer, those students, how can they get in touch?
So for those of who are interested in either of those, you can get in touch with us at Dow Students for hcps@gmail.com.
All right. Well, Freddie, thank you so much for your time and best of luck with everything.
Thank you. Happy to chat.
And that is it for us for now. As always, you can find the latest on our website, cbc.ca/ns, or on the CBC News app. Thanks for watching. We'll see you next time.